Hi students, now we are going to discuss very important questions that are frequently asked and very repeatedly asked in the exams and which are high impact questions. So I am going to give you explanatory answers for each of this and tell you why the other options are not there. So the first question, the direction of enamel rods in the cusp tip is, and the options are vertical, horizontal, oblique, none of the above. I've already mentioned in the enamel class, the direction of enamel rods is different in different parts of the tooth. So in case of permanent teeth, if you take the direction of enamel rods in a permanent teeth, in the cusp tip is vertical, whereas in case of central part of the tooth, middle third and in the cervical portion, they run in oblique direction. Whereas if you take, this is for permanent tooth. If you take a deciduous tooth, the cusp tip, it will be vertical only, no change. But in the central part and the cervical portion, it will be horizontal. So here they have not mentioned it is permanent or deciduous. Only thing they have asked is in the cusp tip. But both in the permanent and deciduous, in the cusp tip, the direction is vertical. So the right answer will be vertical. External manifestation of striophragis is called as. So the options are neonatal line, neonatal ring, perikymeta and enamel crack. So neonatal line is nothing but the prominent line seen between prenatal enamel and postnatal enamel. So that's a prominent line seen in the newborn individuals in the surface of the enamel in a newly erupted teeth, because the type of enamel formed before birth and after birth, quality wise they are different. So that line of demarcation is seen, that's called neonatal line. The other name for neonatal line is neonatal ring. So both these options are not correct. The right answer is perikymeta, because perikymeta is seen as grooves on the surface of the enamel. That is the external manifestation of striophragis. It is one of the surface structures seen on the enamel. Which of the following is not a hypomineralized? So read the question carefully. It is not a hypomineralized structure. So all the incremental lines of Retzius, which is seen in enamel, incremental lines of von Ebner, that is seen in dentin, yes, and the neonatal line, which is also seen in enamel, they are all hypomineralized structures. The only structure that is not hypomineralized is incremental line of Salter, which is an incremental line seen in cementum because it is hypermineralized. So that is how it is different from other incremental lines. So that is the right answer, because incremental lines of Salter is not hypomineralized but it is hypermineralized. The fourth question, the blood supply to the amyloblast before dentin formation is what? Is it dental papilla, dental sac, or both dental papilla and dental sac, or stratum intermedium? Now during the tooth development in the advanced Bell stage, you have the inner enamel epithelial cells here. So this is the inner enamel epithelial cell. Below the enamel organ, you have the dental papilla. Surrounding the enamel organ, you have dental sac. The other name for dental sac is dental follicle. Now in the advanced Bell stage, dentin or enamel formation is not happening. Before that, till the early Bell stage, the inner enamel epithelial cell, they are avascular structure. All the epithelium is avascular. So they are receiving nutrition from the underlying dental papilla. It is easy, because directly from the blood vessels in the dental papilla, the nutrients will get diffused and it will reach the inner enamel epithelial cells. So before dentin formation, up to the early Bell stage, the blood supply to that amyloblast will be, the right answer is dental papilla. However, after the dentin formation, that is in the advanced Bell stage, once a layer of dentin is formed, then a barrier is formed between the inner enamel epithelium and dental papilla. So blood supply cannot reach the inner enamel epithelium. So now the dental sac will provide nutrition to the inner enamel epithelial cells. So two type of questions can come. One is the same question, the blood supply to amyloblast or inner enamel epithelium, both means the same. Before dentin formation is from the dental papilla. Whereas another question can be the blood supply to amyloblast after dentin formation. If a question is asked like that, then the right option will be dental sac. So instead of dental sac, sometimes the option will be having dental follicle. Do not get confused, both are same. So the next question is, which of the following layers is not present in Hertwig's root sheath? So Hertwig's root sheath is an important structure that is formed. Hertwig's epithelial root sheath is formed in the advanced bell stage, that is helping in root formation. So it is made up of only two layers. So the two layers are inner enamel epithelium, that is this one, and this is outer enamel epithelium. So the in-between stellate reticulum and stratum intermedium is absent in Hertwig's epithelial root sheath. So it's a bilayered. One is the inner enamel epithelium, other one is the outer enamel epithelium. So the question here is, which of the following is not present in Hertwig's epithelial root sheath? Inner enamel epithelium is present, outer enamel epithelium is also present. So what is not present is the stratum intermedium and also stellate reticulum. So here the right answer is stratum intermedium. The next question is, formation of dental lamina corresponds to which stage of tooth development? So we have 5 physiological stages in tooth development: initiation, proliferation, morphodifferentiation, histodifferentiation, apposition. So out of this, which particular stage is corresponding to the formation of dental lamina? Formation of dental lamina is the first step in tooth development that happens in the 6th week of intrauterine life. That corresponds to initiation. So initiation is starting point. So the starting point of tooth development is nothing but formation of dental lamina. So that is corresponding to the initiation phase, and that happens in the 6th week of intrauterine life. Sometimes this can also be asked as a question. When does formation of dental lamina happen? The answer is 6th week of intrauterine life. So what is happening in proliferation? The corresponding stage of proliferation is bud and cap stage. Morphodifferentiation is early bell stage. Histodifferentiation is advanced bell stage. The buccopharyngeal membrane ruptures at which day of gestation? It's a direct question, but it's very frequently asked. That is why I put that. The right answer is 27th day of gestation is when the buccopharyngeal membrane will rupture. Only when this membrane ruptures, the primitive oral cavity, which is also called as stomatodium, which is a primitive oral cavity, establish a connection with the foregut. This connection is established only by the rupture of the buccopharyngeal membrane that happens in the 27th day of gestation. Membrana preformativa is one term which is used to refer basement membrane separating which two structures, whether it is enamel organ and dental sac, enamel organ and dental papilla, dental sac and dental papilla, or dental sac and outer enamel epithelium. Always remember, the word basement membrane is always separating epithelium from connective tissue. So basement membrane will always separate epithelium from connective tissue. So here they have already mentioned in the question that membrana preformativa is the basement membrane. That itself is a clue for you. Now if the word basement membrane is not given, it is very confusing for you. But already the word basement membrane is given. So it is separating epithelium from connective tissue. Which epithelium from which connective tissue? Here in the options, which is the two structure? One is epithelium and one is connective tissue. A is that. Because enamel organ is epithelium, dental sac is the connective tissue. B is also there. Enamel organ is epithelium, dental papilla is connective tissue. This is not the option because both dental sac and dental papilla are connective tissue. Again, outer enamel epithelium and dental sac. One is epithelium, another one is connective tissue. So you have confusion between A, B and D. So which do you think is the right answer? The right answer is enamel organ and dental papilla. That is the right answer. So the enamel organ is separated, the basement membrane which is separating the enamel organ from the underlying dental papilla, that is what is called membrana preformativa. This is very frequently repeated question for you. Ninth one, all the permanent teeth develop from lingual extension of dental lamina except. So the question here is except. So dental lamina will have a lingual extension, that is called successional lamina. So successional lamina will give rise to permanent teeth. All the permanent teeth will arise from successional lamina. That is the lingual extension of dental lamina. Only molars will not arise from that. Yes, so the answer is molars. So except molars, all the other teeth, that is your canines, incisors, premolars, all the other permanent teeth will arise from lingual extension of dental lamina. Only the permanent molars will not arise from that. So where will the permanent molars arise from? The permanent molars will arise from distal extension of dental lamina. The word distal is important here. The other name for that is accessional lamina. So the distal extension of dental lamina, also called accessional lamina, is where the molars will come. Undifferentiated mesenchymal cells are seen in which tissue? Is it pulp? Is it periodontal ligament, or both pulp and periodontal ligament? None of the above. So the answer is obviously C, both A and B. That is, you see it both in the pulp as well as the periodontal ligament. Now, in case of periodontal ligament, you might not use the word undifferentiated mesenchymal cell, but instead of that, they will use the word progenitor cells. But if you carefully read, the progenitor cells are nothing but they are undifferentiated mesenchymal cells. So please remember, because many times the students will give the option as only pulp. Because in the textbook clearly it is written in pulp you see undifferentiated mesenchymal cells. But be very careful, because even in the periodontal ligament also you are seeing the undifferentiated mesenchymal cells, which are specifically called as progenitor cells. So here the answer is both A and B. The 11th question, which of the following is not an ectomesenchyme derivative? So in the tooth and the supporting structures of the tooth, only structure that is not derived from ectomesenchyme is the enamel. Why? Because enamel is directly derived from epithelium. This epithelium is arising from ectoderm only. The germ layer is the ectoderm, but the structure is epithelium. Which epithelium? Oral epithelium. Because the oral epithelium only proliferates to form dental lamina. The terminal part of the dental lamina only forms the enamel organ. From the enamel organ only enamel is arising. So in other words, if you have to go back in terms, enamel is actually formed from amyloblast. Amyloblasts are nothing but it is formed from inner enamel epithelial cells. Inner enamel epithelial cells are actually seen in the enamel organ. Enamel organ is actually formed from dental lamina. Dental lamina is formed from oral epithelium. Therefore, enamel is an epithelial derivative. So, only enamel is an epithelial derivative. All the other cells, whatever you see, other tissues, dentin, pulp, periodontal ligament, alveolar bone, all these are cementum, all these are ectomesenchyme. So, they are all ectomesenchyme. Only enamel is epithelium. So, the answer is enamel. The next question, which of the following is not a neural crest derivative? Again, this is very important, very frequently asked for you. Which is not a neural crest derivative? Ectomesenchyme is a neural crest derivative. Cranial nerves and cranial ganglia are neural crest derivatives. Adrenal medulla is also neural crest. So, which is not a neural crest is adrenal cortex. So, adrenal cortex is derived from where? It is derived from mesoderm. Whereas neural crest is actually derived from ectoderm. So from the ectoderm, neural crest is arising. The neural crest is giving rise to adrenal medulla, ectomesenchymal cells and cranial nerves and cranial ganglia. Whereas adrenal cortex is totally different in embryological development. It is arising from the mesoderm. So the answer here is adrenal cortex. Because embryologically adrenal cortex and medulla are arising from different germ layers, functionally also they are different. So the next question is muscles of facial expression. That is, you have so many muscles, orbicularis, oris, buccinator, so many muscles that will change the expression of face. They are derived from which arch? First pharyngeal arch or branchial arch. The other name for pharyngeal arch is branchial arch. So the first branchial arch, second, third and fourth branchial arch. Which of these branchial arches muscles of facial expression are derived? So the answer is second branchial arch. So I already told you there is a tabular column given in standard textbooks. For oral histology, you can either follow Orban's or Tenkate. These are the two standard textbooks which is prescribed by Dental Council, and all your MCQs that are asked from NEET exams, they are all based on these two textbooks. So any of these textbooks only, they will pick up the questions, and the key answers also will be in these textbooks only. So you please go through these textbooks. You have a tabular column, standard tabular column, where they have given all the derivatives from first, second, third and fourth arch. Kindly by heart that, keep it in mind. Keep repeatedly reading it again and again. Only then you will remember. So because one question will be definitely asked from derivatives of branchial arches. So muscles of facial expression is by second branchial arch. So it is supplied by facial nerve because the nerve associated with the second branchial arch is facial nerve. So the muscles of facial expression will be supplied by the facial nerve. Which of the following is not involved, not in the formation of lips? So in the lips, you have upper lip and lower lip. For upper lip, you have median nasal process and maxillary process. That is for the upper lip. Whereas in the lower lip, you have mandibular process. So when you combine both this, which is not involved in the formation of lip, the answer will be lateral nasal process, because lateral nasal process is not involved in the lips. It is only helping in the formation of ala of the nose. Next question is, which of the following is not a remnant of Meckel's cartilage? So what is Meckel's cartilage? During the development of mandible embryologically, there is a primary cartilage that is formed, which is called Meckel's cartilage. That cartilage will form as a scaffold over which the substance of the mandible, that is the body and ramus of the mandible, will form. Later, this Meckel's cartilage will disintegrate, but some remnants of this Meckel's cartilage will be left behind. What are those remnants? Incus and malleus. Incus and malleus are ear ossicles, which is present inside the ear, middle ear. So, this incus, malleus and sphenomandibular ligament. Sphenomandibular ligament is the ligament that is connecting the mandible with the sphenoid process. All these three are actually remnants of Meckel's cartilage. Which is not a remnant is stylomandibular ligament. So stylomandibular ligament connects the styloid process with the mandible. That is not a remnant of Meckel's cartilage. Muscles of the tongue develop from which part? So muscles of the tongue have a specific development. The answer is straightforward, occipital somites. That is why the nerve supply for the muscles of the tongue, both intrinsic muscles and extrinsic muscles, they are supplied by hypoglossal nerve, 12th cranial nerve. That is because embryologically they are all developed from occipital somites. Whereas the main substance of the tongue, mucosa of the tongue, is formed from lingual swellings, tuberculum impar. This is two are forming the anterior 2/3 of the tongue, whereas hypobranchial eminence forms the posterior 1/3 of the tongue. These are all formed by the substance of the tongue, whereas the muscles of the tongue are actually formed by occipital somites. That is why the anterior 2/3 is formed from the first pharyngeal arch and the nerve supplies the lingual nerve. Whereas the posterior 1/3 is the glossopharyngeal nerve, 9th cranial nerve, because it is developed from the 3rd pharyngeal arch. That is why it is supplied by the glossopharyngeal nerve. The next question is the 17th question. Cell junctions that connect the cells to the matrix are called. I already told you there are two types of cell junction. One is those connecting cell to cell attachment between two epithelial cells, that is called desmosomes. Whereas the cells, especially the basal cells, if they are attached to the basement membrane, which is also called as the matrix. So cell to basement membrane or cell to matrix is another type of cell junction called hemidesmosome. So the answer here is hemidesmosome. If the question is between the cell junctions that connect in cell to cell attachment or between two epithelial cells, then the answer will be desmosome. But here the question is between cell and matrix, so the answer is hemidesmosome. The secondary cartilage in the development of maxilla is. Now please remember, both in maxilla and mandible, you have primary cartilages and secondary cartilage. So in maxilla, the primary cartilage is called the nasal cartilage. That will be resorbed and then it will be replaced by bone. In secondary cartilage is called zygomatic cartilage, otherwise known as malar cartilage. That is the secondary cartilage. In case of mandible, again you have primary and secondary cartilage. The primary cartilage is Meckel's cartilage. Already I told you Meckel's cartilage. Secondary cartilage, you have condylar cartilage, coronoid cartilage and symphyseal cartilage. Okay. So the question here is the secondary cartilage in the development of maxilla. So the answer is malar cartilage. So this is very, very important. All of this can be asked as an MCQ question for you. Primary cartilage in maxilla is nasal, secondary is malar or zygomatic cartilage. Whereas the primary cartilage in mandible is Meckel's cartilage. Secondary cartilage, we have three types: condylar, coronoid and symphyseal cartilage. The next question is the predominant type of collagen that is present in the embryonic connective tissue. Now, please note the question is embryonic connective tissue. So, the answer is type 3 collagen. Now, if the question is just the predominant type of collagen present in the connective tissue, then the answer will be type 1 collagen. So, the clue here is very, very important. Keyword is embryonic. Because in the embryonic life, in the mesenchymal tissue, you have collagen fibers. But the predominant type is type 3. That's the question here. Whereas in the adult life, postnatal life, after birth, the main type of collagen fiber that you see in any connective tissue, whether it is supporting connective tissue like lamina propria that you see in the oral mucosa, or the pulp, or the periodontal ligament, or specialized connective tissue like bone, any of this, the main type of collagen in a postnatal life is type 1, whereas in the embryonic life it is type 3. Next question is osteoclast. They are bone resorbing cells. That is the function of osteoclast. They are derived from which cells? Whether it is mesenchymal cell, monocyte, osteoprogenitor or pre-osteoblast. The answer is monocyte. So many times I have repeated this. In the circulating blood, you have the monocytes. These monocytes will leave the circulation, and when they enter the tissue, they are no more called monocytes, but they are called macrophages. These macrophages in different tissues, you have different names. If it is a bone tissue, you call it as osteoclast. So, osteoclast actually arises from a blood monocyte. If it is in the case of liver, you call it as a Kupffer cell. In case of lung, it is called as alveolar macrophages. And in case of the brain, it is called microglial cells. Any of this can be asked as an MCQ question for you. The macrophages that is seen in the central nervous system or brain is called as microglial cells. Vitamin C is a cofactor for which of the following reaction in collagen synthesis? So, when collagen is formed by fibroblast, you have a lot of cofactors for various reactions, enzymatic reactions happening here. So, for this, vitamin C is acting as a cofactor for one reaction. The answer is hydroxylation. So, hydroxylation is the mechanism where OH group, hydroxyl group, is added to the amino acids. That process is called hydroxylation. For this, you need enzymes, prolyl hydroxylase, lysyl hydroxylase. These are the two enzymes which are needed for hydroxylation reaction. For these two enzymes, vitamin C is acting as a cofactor. Therefore, you have to keep in your mind that vitamin C deficiency occurs that will affect the hydroxylation reaction. So, collagen synthesis will be affected. So, any collagen related disorders will be collagen defect will be seen in vitamin C deficiency, that is scurvy. You know what is scurvy? Scurvy is a disease characterized by vitamin C deficiency. In scurvy, collagen is the main structure that will be affected because periodontal ligament and alveolar bone contains a lot of collagen. Scurvy will result in destruction of the periodontal ligament and mobility of tooth. The convexities of dentino-enamel junction faces what? So, we know that dentino-enamel junction is a scalloped junction. It is not a straight line. On top, you have enamel which are made up of enamel rods, and in the lower part, you have dentin which is made up of S-shaped dentinal tubules. Now, this scalloping is in such a way that the concavity or depression is towards the enamel, that is the concavity, whereas the convexity is towards the dentin. So, the answer here is dentin because the convexity is towards the dentin. If the same question can be asked in the other way, the concavities are facing which side, then the answer will be enamel. Bone precursor cells are seen in which part? The options are outer layer of periosteum, inner layer of periosteum, Haversian canal and interstitial lamella. Now, you all remember the structure of bone, especially the compact bone. There is a central Haversian canal which contains the blood vessels. Surrounding that, in concentric layers, bone is formed. So, between two osteons, whatever you see, that is called interstitial lamella. The connecting lamella between two osteon is called interstitial lamella. Haversian canal is the central part of the osteum which contains the blood vessels. Now the entire bone is surrounded by a protective covering. That protective covering is called periosteum. Peri means surrounding, osteum means bone. So the entire bone is surrounded by a protective connective tissue covering that's called periosteum. Periosteum is a double layered membrane, inner layer and outer layer. The outer layer is called fibrous layer because it has got a lot of collagen fibers. Whereas the inner layer is called cellular layer because it has got osteoprogenitor cells or precursor cells. So whenever there is a damage or any trauma to the bone, new bone will form from this precursor cells. So the question here is the bone precursor cells are seen in which layer? The right answer is inner layer of periosteum because that layer is called cellular layer where we have osteoprogenitor cells. Which of the following is highly mineralized? Predentin, intertubular dentin, peritubular dentin, odontoblastic process. Odontoblastic process do not have any mineral content. It is only a cytoplasmic extension of the odontoblast, that's all. It is otherwise called as Tome's fiber. Please remember, Tome's process is the cytoplasmic extension of amyloblast, whereas Tome's fiber is another name for odontoblastic process. So that is not at all mineralized. So that option is gone. What about predentin? Predentin is an unmineralized portion. Only the organic matrix of dentin is called predentin. So that option is also not there. Now the two options left are intertubular and peritubular dentin. Out of these two, peritubular dentin is more mineralized compared to intertubular dentin. That is a characteristic feature of peritubular dentin, that the mineralization is higher when compared to intertubular dentin. Which of the following is not true regarding detracts? We know that detract is one of the age changes in dentin. Also, it can be seen in teeth which is having attrition, caries or any pathology. What will happen that time? That time, the dentinal tubules which contain the odontoblastic process will be degenerated. So, the tubules will appear empty and it will be filled with air. So, when light is passing through that, what type of light? Transmitted light, because that is what is commonly used. When transmitted light is passing through these empty dentinal tubules containing air, it will appear black in color. So therefore, detracts will always appear black in transmitted light. Any structure that is appearing black in transmitted light will automatically appear white in reflected light. So depending upon the type of light we use, the color will be different. Anything that is appearing black in transmitted will look white in reflected light. So with that in mind, if you have to choose the right answer here, which is not true is what they are asking. So degeneration of odontoblastic process is correct. Entrapment of air within the dentinal tubules is also seen in detracts. It is appearing white in reflected light, that is also correct. It is appearing white in transmitted light is not correct. So that is the right option here, which means in transmitted light, detract is supposed to be black in color. But here the option is given as white. So that is the right option here. So these are all the high impact questions which are very frequently repeated and more confusing for you because the options are also difficult to pick up. So if you know the basic concepts correctly, then easily you can pick up the right answer.